Comprehensive NCLEX RN Practice Exam 11-2026. Question 1. A patient is admitted to the hospital with a diagnosis of primary hyperparathyroidism. A nurse checking the patient's lab results would expect which of the following changes in laboratory findings? A. Elevated serum calcium. B. Low serum parathyroid hormone, PTH. C. Elevated serum vitamin D. D. Low urine calcium. Hyperparathyroidism results in excessive PTH, which pulls calcium from the bones into the bloodstream, causing elevated serum calcium, hypercalcemia. Question 2. A patient with Addison's disease asks a nurse for nutrition and diet advice. Which of the following diet modifications is not recommended? A. A diet high in grains. B. The diet with adequate caloric intake. C. The high-protein diet. D. A restricted sodium diet. Addison's disease causes sodium wasting due to low aldosterone. Patients usually require a high-sodium diet, so a restricted sodium diet is not recommended. Question 3. A patient with a history of diabetes mellitus is in the second postoperative day following cholecystectomy. She has complained of nausea and isn't able to eat solid foods. The nurse enters the room to find the patient confused and shaky. Which of the following is the most likely explanation for the patient's symptoms? A. Anesthesia reaction. B. Hyperglycemia. C. Hypoglycemia. D. Diabetic ketoacidosis. Confusion and shakiness in a diabetic patient who is post-op and not eating are classic signs of hypoglycemia, low blood sugar. Question 4. A nurse assigned to the emergency department evaluates a patient who underwent fiber optic colonoscopy 18 hours previously. The patient reports increasing abdominal pain, fever, and chills. Which of the following conditions poses the most immediate concern? A. Bowel perforation. B. Viral gastroenteritis. C. Colon cancer. D. Diverticulitis. Abdominal pain, fever, and chills following a colonoscopy are red flags for bowel perforation, which is a surgical emergency. Question 5. A patient is admitted to the same-day surgery unit for liver biopsy. Which of the following laboratory tests assesses coagulation? Select all that apply. A. Partial thromboplastin time. B. Prothrombin time. C. Platelet count. D. Hemoglobin. PTT, point, and platelet counts are all critical assessments of the blood's ability to clot, which must be verified before an invasive liver biopsy. Question 6. A patient on the cardiac telemetry unit unexpectedly goes into ventricular fibrillation. The advanced cardiac life support team prepares to defibrillate. Which of the following choices indicates the correct placement of the conductive gel pads? A. The left clavicle and right lower sternum. B. Right of midline below the bottom rib and the left shoulder. C. The upper and lower halves of the sternum. D. The right side of the sternum just below the clavicle and left of the precordium. Standard defibrillator pad placement is at the upper right sternum, below the clavicle, and the apex of the heart, left of the precordium, to ensure the current passes through the myocardium. Question 7. The nurse performs an initial abdominal assessment on a patient newly admitted for abdominal pain. The nurse hears clicks and gurgles in all four quadrants as well as swishing or buzzing sound. Which of the following statements is correct? A. The frequency and intensity of bowel sounds varies depending on the phase of digestion. B. In the presence of intestinal obstruction, bowel sounds will be louder and higher pitched. C. A swishing or buzzing sound may represent the turbulent blood flow of a brute and is not normal. D. All of the above. All statements are correct. Bowel sounds vary by digestion, obstruction causes high-pitched sounds, borborygmi, and brutes indicate abnormal vascular turbulence. Question 8. A patient arrives in the emergency department and reports splashing concentrated household cleaner in his eye. Which of the following nursing actions is a priority? A. Irrigate the eye repeatedly with normal saline solution. B. Place fluorescein drops in the eye. C. Patch the eye. D. Test visual acuity. chemical burns to the eye require immediate and profuse irrigation to neutralize the pH and minimize permanent ocular damage. Question 9. A nurse is caring for a patient who has had hip replacement. The nurse should be most concerned about which of the following findings? A. Complaints of pain during repositioning. B. Scant bloody discharge on the surgical dressing. C. Complaints of pain following physical therapy. D. Temperature of 101.8 F, 38.7 C. While post-op pain is expected, a temperature of 101.8 F, 38.7 C, may indicate a developing infection or deep vein thrombosis, DVT. Question 10. A child is admitted with an uncontrolled seizure disorder. Which of the following actions would not be included in the event of a seizure? A. Notify the physician. B. Restrain the patient's limbs. C. Position the patient on his/her side with the head flexed forward. D. Administer rectal diazepam. Restraining a patient during a seizure can cause musculoskeletal injury. The priority is to protect the airway and prevent injury by clearing the environment. Question 11. A patient who has received chemotherapy for cancer treatment is given an injection of epoetin. Which of the following should reflect the findings in a complete blood count, CBC, drawn several days later? A. An increase in neutrophil count. B. An increase in hematocrit. C. An increase in platelet count. D. An increase in serum iron. Epoetin, epigen/procrit, stimulates the production of red blood cells, which is measured as an increase in hematocrit and hemoglobin. Question 12. A patient is admitted to the hospital with suspected polycythemia vera. Which of the following symptoms is consistent with the diagnosis? Select all that apply. A. Weight loss. B. Increased clotting time. C. Hypertension. D. Headaches. Polycythemia vera involves an overproduction of RBCs, leading to hyperviscosity. This causes hypertension and headaches. Clotting time is usually decreased, increased risk of clots. Question 13. A nurse is caring for a patient with a platelet count of 20,000/microliter. Which of the following is an important intervention? A. Observe for evidence of spontaneous bleeding. B. Limit visitors to family only. C. Give aspirin in case of headaches. D. Impose immune precautions. A platelet count below 20,000 puts the patient at extreme risk for spontaneous bleeding, intracranial or GI. Aspirin is strictly contraindicated. Question 14. A nurse in the emergency department assesses a patient who has been taking long-term corticosteroids. Which of the following is a typical side effect of corticosteroid treatment? Select all that apply. A. Hypertension. B. Cushingoid features. C. Hyponatremia. D. A low serum albumin. Chronic corticosteroid use leads to Cushingoid features, moon face, buffalo hump, and sodium/water retention, which causes hypertension. Question 15. A nurse is caring for patients in the oncology unit. Which of the following is the most important nursing action when caring for a neutropenic patient? A. Change the disposable mask immediately after use. B. Change gloves immediately after use. C. Minimize patient contact. D. Minimize conversation with the patient. Hand hygiene and proper use of gloves are the most effective ways to prevent the transmission of pathogens to a neutropenic, immunocompromised patient. Question 16. A nurse is counseling patients at a health clinic on the importance of immunizations. Which of the following information is the most accurate regarding immunizations? A. All infectious diseases can be prevented with proper immunization. B. Immunizations provide natural immunity from disease. C. Immunizations are risk-free and should be universally administered. D. Immunization provides acquired immunity from some specific diseases. Immunizations provide artificially acquired active immunity against specific pathogens. They are not natural and do not cover all infectious diseases. Question 17. A patient is brought to the emergency department after a bee sting. The family reports a history of severe allergic reaction. Which of the following is the most urgent nursing action? A. Consult a physician. B. Maintain a patent airway. C. Administer epinephrine subcutaneously. D. Administer diphenhydramine, Benadryl, orally. In a potential anaphylactic reaction, maintaining a patent airway is the absolute priority, ABC, before administering medications. Question 18. A mother reports her son is experiencing side effects from ADHD medication. Which of the following side effects are typically related to medications used for ADHD? Select all that apply. A. Poor appetite. B. Insomnia. C. Sleepiness. D. Agitation. Stimulants used for ADHD, like Ritalin or Adderall, commonly cause decreased appetite, insomnia, and sometimes increased agitation or irritability. Question 19. A patient taking Haldol, haloperidol, reports abnormal movements of her face and tongue. The nurse concludes that the patient is experiencing which of the following symptoms? A. Comorbid depression. B. Psychotic hallucinations. C. Negative symptoms of schizophrenia. D. Tardive dyskinesia. Tardive dyskinesia is a late-onset extrapyramidal side effect of antipsychotics like Haldol, characterized by involuntary movements of the tongue and face. Question 20. A patient with newly diagnosed diabetes mellitus is learning to recognize the symptoms of hypoglycemia. Which of the following symptoms is indicative of hypoglycemia? A. Polydipsia. B. Confusion. C. Blurred vision. D. Polyphagia. Hypoglycemia deprives the brain of glucose, leading to neuroglycopenic symptoms such as confusion, irritability, and altered consciousness. Question 21. A child is admitted to the hospital with a diagnosis of Wilms tumor, stage 2. Which of the following statements most accurately describes this stage? A. The tumor is less than 3 centimeters in size and requires no chemotherapy. B. The tumor did not extend beyond the kidney and was completely resected. C. The tumor extended beyond the kidney but was completely resected. D. The tumor has spread into the abdominal cavity and cannot be resected. In stage 2 Wilms tumor, the cancer has grown into surrounding tissues like fat or blood vessels but was still able to be completely removed during surgery. Question 22. A teen patient is admitted for suspected acute glomerulonephritis. Which of the following findings is consistent with this diagnosis? Select all that apply. A. Urine-specific gravity of 1.040. B. Urine output of 350 milliliters in 24 hours. C. Brown, //T-colored / urine. D. Generalized edema. Acute glomerulonephritis is characterized by oliguria, low output, hematuria, T-colored urine, and fluid retention, edema. Question 23. Which of the following conditions most commonly causes acute glomerulonephritis? A. A congenital condition leading to renal dysfunction. B. Prior infection with group A streptococcus within the past 10 to 14 days. C. Viral infection of the glomeruli. D. Nephrotic syndrome. Acute post-streptococcal glomerulonephritis, APST, typically follows a throat or skin infection with group A beta hemolytic strep. Question 24. An infant with hydrocele is seen at 1 month of age. The scrotum is smaller than it was at birth, but fluid is still visible. Which of the following actions is the physician likely to recommend? A. Massaging the groin area twice a day until the fluid is gone. B. Referral to a surgeon for repair. C. No treatment is necessary, the fluid is reabsorbing normally. D. Keeping the infant in a flat, supine position until the fluid is gone. Congenital hydroceles are common and usually resolve on their own within the first year of life as the fluid is reabsorbed. Question 25. A nurse is caring for a patient with peripheral vascular disease, PVD. Which of the following is the most likely explanation for burning and tingling of the hands and feet? A. Inadequate tissue perfusion leading to nerve damage. B. Fluid overload leading to compression of nerve tissue. C. Sensation distortion due to psychiatric disturbance. D. Inflammation of the skin on the hands and feet. PVD results in chronic ischemia. When nerves are chronically deprived of oxygenated blood, they become damaged, resulting in neuropathic pain, burning/tingling. Question 26. A nurse is assessing a clinic patient with a diagnosis of hepatitis A. Which of the following is the most likely route of transmission? A. Sexual contact with an infected partner. B. Contaminated food. C. Blood transfusion. D. Illegal drug use. Hepatitis A is transmitted via the fecal-oral route, frequently through the consumption of contaminated food or water. Question 27. A leukemia patient has a relative who wants to donate blood for transfusion. Which of the following donor medical conditions would prevent this? A. A history of hepatitis C 5 years previously. B. Cholecystitis requiring cholecystectomy 1 year previously. C. Asymptomatic diverticulosis. D. Crohn's disease in remission. A history of hepatitis C is a permanent disqualification for blood donation to prevent transmission of the virus to the recipient. Question 28. A physician has diagnosed acute gastritis in a clinic patient. Which of the following medications would be contraindicated for this patient? A. Naproxen sodium, naproxen. B. Calcium carbonate, Tums. C. Clarithromycin, Biaxin. D. Furosemide, Lasix. Naproxen is an NSAID that can irritate the stomach lining and exacerbate gastritis or cause gastric bleeding. Question 29. The nurse is conducting nutrition counseling for a patient with cholecystitis. Which of the following information is important to communicate? A. The patient must maintain a low-calorie diet. B. The patient must maintain a high-protein/low-carbohydrate diet. C. The patient should limit sweets and sugary drinks. D. The patient should limit fatty foods. Cholecystitis, gallbladder inflammation, is triggered by fat intake, which causes the gallbladder to contract. A low-fat diet is the standard management. Question 30. A patient admitted to the hospital with myocardial infarction develops severe pulmonary edema. Which of the following symptoms should the nurse expect the patient to exhibit? A. Slow, deep respirations. B. Stridor. C. Bradycardia. D. Air hunger. Pulmonary edema blocks gas exchange in the alveoli. The patient experiences extreme dyspnea and the sensation of gasping for breath, known as air hunger.